Hi, this is the last lecture for GERD and peptic ulcer disease. In this lecture, we'll see what's the treatment or management of GERD or peptic ulcer disease under special population cases. Let's start with children. Okay, GERD and children. So if children have like occasional gastroesophageal reflux, the first thing that we would try is antacids like Tums or Melox. But if it's going to be like a daily situation, not an occasional one, then we switch them over to H2 receptor antagonist or PPIs. So for H2 receptor antagonist, the most common ones given in children are Pepcid and Zantac. So Pepcid, both are OTC, available in OTC forms. Zantac can be given as less as for a kid who's more than 1 month old. So that's like the starting thing that they would get the kid on if it's going to be a daily symptom. So if they are suggested to take PPIs, the most common ones that are used for children are Prevacid, Prilosec, and Nexium. So Prevacid, Prilosec, Nexium, all three of them, they come as capsules, and you can actually open those capsules and you can mix it in applesauce for kids who cannot really swallow capsules. It's all these three can be given for kids greater than 1 year. So all these three comes as capsule. You got to remember that. So it's Prilosec, Nexium, that's omeprazole, esomeprazole, and Prevacid, lansoprazole. All three of them can be given. So these are the treatment for GERD in children. So let's go to the next case, that's pregnancy. Okay, for pregnancy, for initially, like say if a patient gets GERD in first trimester, we try to do no meds. We do not want them to take any meds. We should try to see if they can do lifestyle changes, like try to avoid acidic food, like try to avoid chocolate, try to avoid tomatoes, like no alcohol, of course. And there are other things that we would really try before we give them a medication in first trimester. Okay. And in case in patients for like patients if they already have GERD and if they want to manage their GERD, the things that we normally try for patients who are pregnant are antacids or alginic acid, that's Gaviscon, or we would try to give them sucralfate, that's 3 times daily. So these are more like the management thing for pregnancy patients. If they have more severe form of GERD, and if we really are expected to give H2 receptor antagonist, the most commonly used one is the Zantac, ranitidine. So this is the one that has a lot of data about in pregnant population. So that's the one that normally is given, Zantac. So this is generally QD, and it can be increased up to BID for pregnant patients. So if they are recommended a PPI, the most common one that they give is the Prevacid, that's 30 milligrams before meal for complicated GERD. Okay, so but generally we'll try to give Zantac. So that is GERD and pregnancy. Okay, let's see other situation for peptic ulcer disease. Okay, so when your peptic ulcer disease is NSAID induced, we already read that peptic ulcer disease could be caused by continuous use of NSAIDs. So if it is that case, so the first thing that you got to do is like DC, the NSAID. So when you discontinue the NSAID, you got to give them some form of anti-inflammation or reducing the pain medication. So reducing the pain kind of medication. So we switch them to Tylenol, or we should see if we can give Celebrex to them as long as they don't have any sulfa allergy. So we switch them over from the NSAIDs like ibuprofen, and then we move them to Tylenol or Celebrex. That's the first thing to do. And then to relieve their ulcer symptoms or to help them to heal, then we put them in PPIs. Try to start them with a PPI or try to give them H2 receptor antagonist, especially for nocturnal issues. But give them either PPI or H2 receptor antagonist or sucralfate. Sucralfate, you remember that we read that it's more like a healing thing. It coats the ulceration and it helps them to prevent acidic damage to the already existing ulcer. So we try to give this as a second step, and we also ask them to do lifestyle changes. So like I said earlier, no coffee, chocolate, no acidic food, no smoking. We try to do all lifestyle changes along with this. But if they really have to have an NSAID, in cases where they really have to have something anti-inflammatory, So then we add misoprostol. You remember misoprostol? We read this medication. It's a cytoprotective medication, and it comes like in micrograms. But in this case, you give them at least 400 micrograms per day. So you add a misoprostol, but you also, if you have to give a PPI, so you're giving a regular dose PPI along with it. But if you're giving a H2 receptor, you give them a double dose. You remember in the H2 receptor, we had like a regular dose, and the maximum is the double dose for H2 receptor antagonist, or for all of them. You remember when we went through that, we talked about it. So in this case, where NSAID is must, so you give them a misoprostol, and then you also give them a PPI or a H2 receptor antagonist. So if you're giving PPI, then give the regular dose PPI, but if you're giving H2 receptor, then give them the double dose. Okay, so now this is it for special population. So let's quickly go over what we saw here. So I'm just going to quickly brush, it's a very quick revision. So for GERD and peptic ulcer disease, now this is gastroesophageal reflux disease and peptic ulcer disease. Now for this situation, we have to control the acid release inside your stomach. So we do have different classes of medications to treat it. So we saw antacids at the beginning. We saw aluminum. When you think of aluminum, you have to remember that it causes constipation. Calcium too, and then you have magnesium. Magnesium, you have to relate that it's more like a diarrhea causing thing. That's a side effect. So then you saw antacids, and then we saw alginic acid. Alginic acid, remember that it's a medication that floats on the body, so you always have to be upright when you take alginic acid. You have to tell the patient to stay upright. That's more important. And then we saw the H2 receptor antagonist. So in this case, we have like a lot of brand and generic. We saw Pepcid, Zantac. We saw a lot of other medications in that class. We go through all of the brand and generic for it. Tagamet, cimetidine. We saw a lot about cimetidine and its CYP interaction. And what else did we see? We also saw, after that, we saw the proton pump inhibitor. Proton pump inhibitors, we have like omeprazole, esomeprazole, Prevacid. We have some of them. The PEL. There are three that we try to remember as only IV. So that is proton pump inhibitor, and then we have some of them that can be open and mixed in applesauce. And we also talked about how omeprazole and esomeprazole have to be avoided in patients because of the CYP interaction, and also for Plavix. Remember that Plavix basically has to get cleaved in the liver to become a proper drug. So we do not want a medication that reduces the enzymes, cytochrome P50 enzymes, and then we won't have Plavix working for those cases. So we give other PPIs. We saw that, and also we saw sucralfate. Sucralfate is more like a medication that helps in covering the ulceration. We saw that, and we saw cytoprotective agents like misoprostol, how micrograms of it could be given to treat like a cytoprotective agent. So yeah, we saw all that, and then we also went through special population today, like for children, and then for pregnant situation, and what if you have to give peptic ulcer, what if you have to give NSAID for a peptic ulcer case where you really have to have an NSAID, how you handle that. So yeah, we saw all these situations. Okay, go through all of these, and you should be fine. Thank you.